All right, welcome in to everyone to be our guest and to your health. We are with friend of the program, Brent Carter with Blue Cross and Blue Shield of Alabama, and he is going to talk to us today about annual enrollment, the annual enrollment period. Now, you may have heard this if you get your insurance through your employer, and fall is very common for employers as well. You may say, we're doing our annual enrollment. We got to get some information from you because our insurance premiums are changing, et cetera. And that is also called annual enrollment, but this is different. This is for individuals who are on Medicare. They also have an annual enrollment period. And Brent is here to tell us about it. Brent, thanks so much for coming in. Good to see you again.
All right. Thank you, Bobby. Always good to be here and talk to you and talk to people about these annual enrollment periods and so forth.
Yeah, because people are getting a lot of advertising and marketing to them. Especially if you're on any kind of subscription list, you're probably getting things in the mail. Even if you already have your Medicare, you're still being bombarded with all this information. So I guess the first question is, what is the annual enrollment period for Medicare and what are the dates? Because I think we've already kind of
Right.
got into it already, haven't we?
Yes. And that's the big part of it. So really the Medicare annual enrollment period, it runs from October 15th. So we're right at the start of it. And it
Mhm.
runs through December 7th every year. And basically during the annual enrollment period, Medicare, if you're in a plan, it gives everybody a chance to review their plan. Are they satisfied with their coverage? If they're not satisfied, this annual enrollment period allows them to switch plans if they find a better plan that may fit their needs better. And that will be effective January 1st.
Okay, so the deadline to make the change is December 7th. So Pearl Harbor, for those who are older or are history buffs, that's a good way to remember the date. But it doesn't go into effect until it won't actually affect their coverage until January 1st. Now,
Correct.
what are some of the options that people have? Because someone may say, well, I've had kind of this, don't I have just, if you're over 65, kind of just have regular Medicare. What are the different options for those Medicare supplemental plans?
Well, it always starts with original Medicare A and B, and you have to have those. So that's kind of the first step. But the two options, really, there's two paths. You can choose a Medicare Advantage plan, in our case, Blue Advantage, and
Hmm.
we offer multiple plans in each county of the state. And those plans can have a $0 premium, and you pay copays as you go along. You would pay copays if you went into the hospital.
Hmm.
Those plans also include dental coverage, vision coverage, and hearing coverage all in one plan. So it's a
Okay.
great way to to really get more coverage than what original Medicare offers. The second option would be to have a Medicare supplement. In our case, that is our C plus plans. And we
Okay.
have three options available in C plus. And basically the way the supplements work is original Medicare pays 80% of your hospital and doctor bills. The supplement would come and pay the 20% that Medicare doesn't pay. Now there is a Part B
Okay.
deductible for medical services, but those plans cover hospitals and doctors' charges. What a supplement doesn't cover is prescriptions. So you would
Oh.
also, in addition to a true supplement, you would need to enroll in a Part D plan to have, again, hospital, doctor, and prescription coverage.
Okay. So now if you do an Advantage plan and you have some medications, do you also, is it the same thing? You choose either the C plus or the Advantage and you have to choose to add on the Part D for medications?
No, that's a great question. And the Medicare Advantage plans, your prescription coverage, which Part D, as you mentioned,
Hmm.
uh, is included in the Advantage plan.
Included. Okay.
So the only reason you would need to purchase a standalone prescription plan is if you had a supplement.
Okay. Now, what kind of criteria do people need, or what kind of information do people need? Let's say they haven't enrolled in an Advantage plan. They've just turned 65, maybe this year, and they have the basic Medicare, but they don't really know the complexities of it. What kind of information do people use to make a decision between these kinds of plans?
Well, really, the key factors are your doctors in the network in an Advantage plan,
Okay.
and is your hospital of choice, is it in the network? So
Okay.
the hospital and doctor network is very important, as well as your list of prescriptions.
Hmm.
And are your list of prescriptions covered under the formulary? And your formulary is just a list of all the prescriptions that are covered under the plan. So, as part of this process, our team can help look up each prescription and determine whether it's covered under the plan and what tier it's in. And the tier determines what your copay would be at the pharmacy. So it's always
Okay.
good to have that information when you're shopping and considering plans so that we can give you a honest and complete assessment of will this plan work for you?